everyone, and thank you for joining our session on conquering next generation NCLEX questions with a winning exam strategy. So we encourage everyone to send their questions into the chat or the question pane, and that will be addressed at the end if time permits. So without further ado, I would now like to hand it over to Kevin, a registered nurse and founder of The Boot Nurse. Please send them a warm welcome in the chat.
I appreciate that, Marissa. Hey, what's going on, everybody? I am Kevin. I go by The Boot Nurse on all those social media platforms. Make sure you guys go over there and check me out. So there's, a little bit about me. I've been a nurse for 3.5 years. I have, critical care in the ICU, as well as PACU and OR experience. Like I said, I've been doing this for a little bit. And you guys are here because you guys want to know how to conquer the NCLEX, whether you are in nursing school or you have just graduated and ready to sit for your exam, whether you be an LPN or an RN. And I'm here to show you guys, how to conquer the next gen NCLEX with some winning strategies. So you already know what the deal is. If y'all follow me on social media, y'all already know what's up. You already know the energy. Y'all give me the energy in the chat. I'm gonna give you the energy on this presentation. So without further ado, let us jump into it. All right, so first things we're going to talk about, I always cover the content, all the important things. So the purpose of the NCLEX exam is we're going to talk about the nursing action, nursing competency, because I need to make sure that you know what you're doing. The test plan structure, the client needs, aka the 8 sections of the NCLEX-PI, integrated processes, clinical judgment, which is super important, the NCLEX test plan versus 2019 and 2023, because that's the year that we're in, the formats, the new question types, and the changes that happened this year, specifically April 1st. This is not a game. It's not a joke. No April Fool's jokes here. So here we go. All right. So the purpose of the NCLEX exam is I want to assess, your nursing competency. The primary purpose of the NCLEX is to assess your competency seeking your license. It evaluates the knowledge, your critical thinking skills, as well as your clinical judgment to determine if you're prepared to practice safely, because the NCLEX is all about safety. I don't expect for you to be an expert at becoming a nurse once you become a nurse. I want to know that you at least meet the minimum basic requirements that you got while you were in school. And I need to know you know how to apply what you learned in school on this exam. Now, we want to ensure public safety. The exam plays a crucial role in protecting the public by ensuring that only qualified individuals are granted licensure as a registered nurse or a licensed practical nurse. Shout out to all my LPNs out there. I love y'all. Anybody that wants to be an LPN, you already know y'all got my love. By assessing the candidate's nursing competency, the NCLEX helps safeguard patients' well-being and safety. Now, we don't want no hashtag fake nurses out there that happened in Florida and Georgia. The whole point is that you are now a public servant of the people. That's the cut and dry of it, right? So we need to make sure that you are going to be performing safely for the public, taking care of family, friends, and loved ones. There's a standardized. It is standardized, the license. Doesn't matter if it's the RN or the LPN. It's not based off a state. It's based on a national level, regardless of the nursing program or educational institution attended by you. This standardization ensures competency and fairness in evaluating the nursing competency, and it promotes uniformity in the licensure process for the nurse. I also want to enhance professional mobility. Successful completion of the exam is often required by attaining the license in various states, allowing you to practice in different jurisdictions. So we have a thing called the Nursing Licensure Compact. So if you get a nursing license in, we'll say, the state of Texas, you can take your nursing license to go to other places. There are certain states that are not a part of that yet. However, here in due time, it's going to happen, right? So we need to make sure that you learn these things standardized on a national level. That way you can, become that travel nurse to where, you can go get the bag, as the kids call it, right? So there is that. We also want to support quality assurance. The NCLEX contributes to the quality assurance and nursing practice by upholding minimum standards for entry-level nurses. Remember, every nurse that's taking the NCLEX is entry-level, right? It is entry-level. Doesn't matter, right? So I want to know that you know how to perform safely as a nurse, as well as that you have the basic skills, the knowledge that you obtained while you were in school. And it actually helps guide education and curriculum development. The feedback from the NCLEX itself provides valuable insight into the strengths and areas of improvement in nursing education. The information can guide educational institutions in refining the curriculum, their teaching methods, and program outcomes to better prepare future nurses. That is why the new generation NCLEX is the way that it is. All right, so let's talk about the nursing action. And this refers to the actions taken by you, the soon-to-be nurse, to provide competent and holistic care to individuals, families, and communities. These actions encompass a wide range of responsibilities. So we talk about assessment, ADPI, right? Everybody in here should know what ADPI is. We talk about your assessment, diagnosis, planning, implementing, and evaluation. That's exactly how you are going to approach your nursing exam questions. That's like it's no cut and dry. So as soon as the question is read, you're going to be like, okay, do I assess? What do I do? What type of assessment do I do, or do I need to do something now? So do I assess or do I implement? Right. So we also talk about the health promotion. So we educate our patients and communities about healthy behaviors, preventable measures, disease management, and we also like to promote optimal health and prevent illnesses. That's like if you ever decide that you want to become a community health nurse or a public health nurse, you know, like you always you want to prevent illness. You want to prevent illness as well as, you know, promote optimal health. So I live in Texas, specifically. I live in San Antonio, and we have a huge population of diabetes. So one of the things that happens in the education department is promoting being non-sedentary, meaning standing up, walking around, going to exercise, so on and so forth. And the city of San Antonio actually created what they call the Greenway, which is walking paths to promote, you know, getting up, getting off your butt and exercising. So that's a great thing about the health promotions. Advocacy, you always advocate for your patient, right? Especially think about your patient if they're intubated in the hospital and, you know, decisions are trying to be made by even, you know, by family members or by physicians or anything like that. You advocate for them because they have rights. It doesn't matter what position that they're in, and they need to be respected at all points in time. And the well-being of the patient is the top priority. And you also collaborate. So we collaborate with other people in the hospital, such as X-ray and lab and dietitians and other specialty physicians, such as, you know, nephrology, you know, when dealing with the kidneys, or if we need a neurologist, if somebody has a head, neck, and spine injury, you know, stuff like that. And of course, documentation. You always want to accurately document and comprehensively document, right? You want to document like you're a lawyer, as they say, because guess what? If you didn't document, yeah, you know what's up. If you didn't document, it didn't happen. So that's part of the act. That's part of the nursing action plan. All right, so now we're going to talk about nursing competency. So this pretty much entails the skills, knowledge, and abilities of nurses that have to possess and deliver high quality care and meet complex needs of a patient. So with the clinical competency, this includes the knowledge and skills to perform the assessment, implement evidence-based practices and interventions. You want to manage medications and provide safe and effective care. That's what you do. That is the definition of what you do. The critical thinking is you apply those skills to analyze information, you make clinical judgments, prioritize care, and solve complex problems. So I need to be able to present a patient to you. And as I present that patient, what are you going to do? What is the algorithm that you're going to follow? Step 1, 2, 3, and 4. Which ones do you need to skip in order to jump to saving your patient, so on and so forth? Communication. Communication is the key. You deal with so many people, from patients to doctors to other members of the collaboration team to, you know, administrators if you're working in the hospital and all that, or in clinics. So you have to know how to effectively communicate and convey information to all those people. Also, let's talk about cultural competencies. Depending on where you live in the United States or in the world, certain things, you know, can and cannot be done. And recognizing and respecting diverse cultural beliefs, values, and practices, you know, to deliver culturally and sensitive care and promote healthy equality is, you know, part of the competencies that you need to recognize as a nurse. Leadership, right? You want to demonstrate those leadership skills by making decision-making skills and decisions, and delegating, coordinating care, and ensuring a safe and efficient healthcare delivery. Especially if you're one of those nurses, I'll give you an example. If you work in med-surg or medical surgical, as they call it, and you're doing the team method where you're in charge of an LPN and maybe a UAP or a CNA or whatever they want to call them, and you know, you have to delegate specific things, right? Or like you need to do some charting. And so, hey, I need for you to go and take these vitals on this patient, so on and so forth. You do it as a leadership and with the leadership skills as well as making those decisions and delegating. That's the big difference, especially with regards to the RN and the LPN. Ethical practices. You want to do things right and professionally. That's why we hold a standard. We always protect the patient. We maintain confidentiality and we uphold the ethical standards in healthcare. Like I would want you to take care of me and, do it to the highest standard and not slip on that. Okay. Because you got to remember, it's like people willingly or go to hospitals knowing that they are going to get taken care of, especially by the nurses. Number one profession, reigning 21 years, right? So definitely, be a good Samaritan in that regard. Engaging in continuous professional development with lifelong learning. So you're always going to do those continuing educations. Those are never going to go away because you never stop learning. And professionalism, you always want to demonstrate that through accountability, integrity, compassion, respect for patients and your colleagues, and the nursing profession as a whole. So with the NCLEX test plan, we talk about the structure. So everybody is just like, they're so scared of the NCLEX. They're like, what is it? So it's structured based off of these three things: your client needs, the integrated processes, and clinical judgment. That's it in a nutshell. Those are the three biggest things that they look for. Okay. So what are the client needs? The client needs are the 8 sections of the NCLEX pie. So we have management of care. Management of care is the largest section on the NCLEX. It doesn't matter which one you're taking, if you're taking the PN or if you're taking the RN, okay? And those are the questions is like, hey, you're a nurse in the emergency room with 4 patients. Which patient do you see first? That's an example of a management of care question, 15 to 21%, right? And then we have safety and infection control, and then we have health promotions, psychosocial integrity, physiological adaptation, basic care and comfort, pharmacology, which is the second largest section on the exam, reduction in risk potential, and physiological adaptation, which is the third largest section. Physiological adaptation, management of care, and pharmacology make up 44 to 49% of the entire exam. Think about that. I call them the big 3. So, words for thought, right? So think about that. Let's see. All right, so we have our integrated processes. This is where the nurse must understand how to prioritize patient care, recognize and address changes in the patient's situation, and work well with the rest of the healthcare team. So this consists of caring, fostering mutual respect, clinical judgment, which is huge. Clinical judgment, which is huge. All right, so this is thinking critically and providing evidence-based solutions based off of what you learn and what's doctrine, and prioritizing those concerns. Clinical problem solving, right? Collecting data, planning, following trends, implementing, evaluating in order, to find a specific approach. Communication and documentation, because, hey, you got to let people know. We got to go back and forth. I got to let you know what's going on with this patient, either be between the client, it'd be between the nurse, other doctors, other healthcare professionals, and of course, documentation, because if you don't document, it didn't happen. And of course, we talked about cultural sensitivity and spirituality, because depending on what type of individual and what culture and spirituality they have will depend on the approach that you take when it comes to taking care of them. And teaching and learning, because you want to nurture a positive learning environment and establish positive behavior changes. With clinical judgment is you want to recognize cues, right? You want to identify relevant and important information from different sources. So let's look at their medical history, right? I have a 65-year-old man who complains of difficulty breathing, who has a history of congestive heart failure. Oh, okay, that does that. Oh, and let's see what his vital signs are. Let's see what his labs look like. Let's see what his vital signs look like. I think I may have already said that, but y'all get the gist of that. And then you want to analyze those cues, organize and connect the recognized cues to the client's clinical presentation, right? So I want to be able to okay, if I see a white blood cell count that's over 15,000, I'm going to be like, he may have an infection. No, he does have an infection, because it's definitely outside of range when it comes to those labs. You want to prioritize hypotheses. So I want to evaluate and prioritize. So what is the urgency? What is the risk? What is the, what's the difficulty? What are the time constraints? Like, who's going to die if I don't see them first? You want to generate solutions. So what are you thinking? If I see somebody who has difficulty breathing, what's the very first thing that I want to do? Or what is the most important thing that I could do? If I could do one thing and leave, what would it be? Right? And then you want to take action. Do what you need to do. Hey, do I need to lift head of bed? Do I need to give them oxygen? Are they massively hemorrhaging? So do I want to do CPR, or do I want to stop the bleeding? Right? And then you want to evaluate the outcome. Like, based off of the interventions that I provided, did they work? If they didn't work, I need to go back and I need to do what I need to do. So essentially, it's like what matters most when it comes to cues, recognizing cues. When it comes to analyzing, is like what could it mean? Prioritizing hypothesis is like where do I start? Generate a solution. What could I do? Take action. What will I do? And the evaluating outcome is, did it help? Did what I did it help me? Right? Did it help me? Did it help me get there when it comes to clinical judgment? Okay. All right. So here we go when it comes to the NCLEX test plan. So the NCLEX itself hasn't changed much since 2019, right? And they evaluate every 3 to 5 years or so, right? So like I said, it hasn't changed much. However, there are various noteworthy additions that improve the test plan. So clinical judgment, right? So the new NCLEX for 2023 presents highlighted fundamental processes that are highly relevant and important in delivering safe and effective care. That is what they want. They do research based off of what is happening now in the world, the NCSBN. That is what they do. They isolate these factors and then they make certain questions and they do research and then they put those questions out into the test plan with such as those research questions that you're going to see, right? And then they distribute a content percentage. The content percentage that they do is not high. It's like there's no change to the overall content that happened from 2019 to 2023. It's all about how it is delivered, right? And the client, so we'll talk about the client need category and subcategories, which include clinical judgment processes that come up. You get 18 case study questions, right? And that's about 10% of the standalone items, which are the questions themselves. And we'll talk about the exam length. So in 2019, it used to be 75 to 150 or so questions, with 15 of them being unscored because they were what they call research questions. But in 2023, which happened April 1st, it went from 75 to 150 to 85 to 150, with still 15 of those being research questions. Okay. In regards to scoring the NCLEX, there's 3 different methods now that they use, and I'm pretty sure everybody knows exactly like what they are now. We have the plus or minus, you have the 0-1, and you have the rationale scoring. So the plus or minus, either you like when you answer it. Well, we'll go into that a little bit further. And then of course we have the NCLEX terminology. So there's an update to the order and prescription terminology, such as order, which is intervention, remedy, or treatment as directed by an authorized provider, and a prescription, intervention as it is related to medication directed explicitly by an authorized provider. Okay. Let's see. And so here is kind of like what the changes that happened from 2019, 2023. Not much has happened, but you see how much emphasis of where they move some things. So from 2019, management of care was 17 to 23. Now it's 15 to 21. With safety and infection control, it was 9 to 15%, and now it's 10 to 16%. With health promotions and psychosocial, they stayed the same. Basic care and comfort stayed the same. Pharmacology actually went up in percentage by 1, so 12 to 18, 13 to 19. And then with the reduction of risk and physiological adaptation, they relatively stayed the same. All right, so one thing I'll tell you is that with the new generation NCLEX, all of these old question types, they're all still there. So your multiple choice, which are the most common questions that you will see on the NCLEX, and they provide multiple answers for a question for which you have to select one. That's what happens, right? Your select all that apply did not go away. They will be there, right? Your hotspot, which, they're less common, but hotspot questions have, you select a particular area like, hey, where do I do a glucose check on my finger, right? Or where is the mitral valve when you're checking the heart rate of a patient, right? Fill in the blanks haven't gone away. Drag and drop haven't gone away. Charts and graph questions have not gone away. Graphics, answering multiple choice have not gone away. And then audio and video. These are actually kind of rare to see. Like you may see them. You may get one question that's like that. Like, hey, like what type of breathing is this? Is it stridorous? Is it ronchi? Or ronchi, however you want to pronounce it. So these are the ones that are still there. And like I said, the common questions that you're going to get are going to be the multiple choice questions. Okay. All right. Now with the new generation, with the new question types, you have case scenarios, right? The NCLEX questions have traditionally been standalone questions, each question unrelated to the other. But the new NCLEX, 2 to 8 questions may be derived from a single question. That's what the case scenarios are. And that's, of course, where they give you, your vital signs, your medical history, lab values, all that good stuff. These cases provide client records with multiple tabs and split screens. So if you guys have been practicing that way, you guys will be able to see those. You'll have the extended multiple choice. A significant difference with these questions is that they are partial credit. Your extended multiple choices are partial credit. You have your drag and drop, essentially a cross between multiple choice and fill in the blank. These questions provide a drag and drop list of possible answers to complete a sentence. So the thing about the drag and drop is you need to be you have to get both of them right. So if it's fill in the blank with a drag and drop, where you see the answers, you can't get one right and then the other one wrong. If you don't match them up that way, the answer is incorrect. So you have to get both of them right. Then you have the extended drag and drop, right? This question type is like the traditional drag and drop, except that there are more answers than spaces, and some answers are excluded. So you'll get the extended drag and drop, and you'll be like, okay, well, I hope I picked the right one. You have the highlighted text, which in my opinion, I think is like a gimme type of question. They're going to be like, hey, what are the important things from this passage, right? So, what are the important, think about an assessment that you've done while you were in nursing school. Like, hey, he came in and he was doing okay. He had a heart rate of, 81. And now when I reassessed him, an hour later, he had a heart rate of 105. Okay. So what is the important thing that was said there? That was it, right? And then you have the matrix grid. It's seen on multiple choice responses. These are like select all that apply questions, but with more than just select or don't select. For example, there may be a list of 8 different interventions you have to choose if they are anticipated, non-essential, or contraindicated based on the question stem. And then, of course, we have our trends. Okay. So here's an example. Of essentially like what an extended multiple choice response will look. It's like, although multiple response items such as select all the apply questions are on the new NCLEX or on the current NCLEX, extended multiple responses will expand on the number of questions for each. So this is it's kind of close. So essentially, you'll get this basic part right here where it talks about, hey, you're the nurse providing care to a 60-year-old male, and then every one of them have a tab. So here's the health history, the nursing notes, the vital signs, and the lab values. And then here's your question that you have to follow. The nurse receives the order, right? So which of the following findings would exclude this patient from receiving this medication? Select all that apply. Click, 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 answer your question, on to the next. All right, so now we have our extended drag and drop. These question types require you to drag the responses into one of the blank answer spaces, and you will now have to determine whether they should use some or all of them. So you have to determine which one. So, and it's based off of you selecting these are based off of this portion right here, right? So it's like, oh, okay, I have this going on. Let's see, like, what's a risk factor? What's a risk factor for me, when it comes to, somebody who has an ischemic stroke or, show signs and symptoms or a risk for it? Oh, okay, well, let's think about this. All right, so we have a patient, his spouse, they were walking their dog at 9 a.m. The spouse turned around and then suddenly reported having a headache and dizziness with slurred speech. Oh, okay, well, I know that slurred speech is a neurological issue, right? So then, let me think about that. So I'll hold on to that one. And so then we're talking about having right side hemiplegia and confused developed, right? And then they start talking about all these other things that they have going on. Oh, let's look down here. It shows that he has a health history, which has hypertension. So smoked for 30 years, hyperlipidemia, type 2 diabetes, no head trauma or recent surgery, and has a BMI of 32. So what are the modifying factors that I could put over here, right? Has a BMI of 32. I think I could probably fix that, right? Is his type 2 diabetes managed, right? Like, does he on insulin? Does he exercise? Does he have a bad diet? Stuff like that. All right, so our close, which is our drop down, right? This is where I was talking about where these are the drop down options that allow you to select a correct answer, and they are now multiple drop down boxes in the closed question. So this is your here's your question right here. And then here is your answer. You have drag and drop, right? Drag or click and drop, or I'm sorry. And you pick one, right? And you have to get both of these correct. If you don't get them correct, the whole answer will be incorrect. So get one correct, that's 1 point, or the answer is correct. If you get this one correct and that one incorrect, the whole answer or the whole question is incorrect. All right, we have our enhanced hotspot, right? Our enhanced hotspot, this enhanced item type allows you to select, or as we say, highlight the relevant words or phrases from a sample medical record that corresponds to the question. And when you are taking your exam, they'll be highlighted, right? So, it essentially pulled everything from the original question or the original portion of the health history. And you're like, okay, so what are the important things that I need to know? Imagine if you were in clinicals, getting a report. They tell you the most important things that you need to know. So if you think about it in regards to, hey, I got a report from so-and-so, think about it like that, and that will help you narrow down what answers you need to highlight for this particular question. All right, and then we have our matrix grid. Our matrix grid is like this item type features rows and columns with options that you must choose. So based off of the patient's health history, the nursing note, the vital signs, and the labs, they give you your question right here. And now you need to know if any of these orders that the provider put in, are they appropriate or inappropriate, right? So if I have a patient who has a risk of, possibly a stroke, but they also have all these issues such as hyperlipidemia, type 2 diabetes, a BMI of 32, right? So it's like, what should I do, right? Is it appropriate for me to do a lumbar puncture? Appropriate or inappropriate? Do I need to do a CBC? Appropriate, inappropriate, right? Do I need to do an NG tube? Do I need to do an INR? He has a history of being confused. Do I need to do a glucose check? Do I need to do a CT scan? If he's at risk for having an ischemic stroke, do I want to do a CT scan? Is that appropriate? That's how you have to break those questions. That's how you have to break the questions down in order for you to find the answer. I'm a huge content guy, huge content guy. So if you have to understand the content in order to apply it to NCLEX style questions. Oh, and another funny note is once you become a nurse and you want to go further on and you want to be an MP or something along those lines, doesn't change. Like the question types and the way that they ask them are also the same. All right. So the changes, like I said before, the new NCLEX is composed of the current items and the new test items. So like I said, the most common one that you're going to see is the multiple choice from the old style of the exam. And the new types of the question types is called the NGN, or the next generation NCLEX test items. I don't know why they call it next generation, because technically we're in the new generation. So it should be the current generation, but whatever. The test will be 85 to 150 questions with 15 pilot questions or research questions that don't count for your first 85. You have 5 hours to take the exam. And then, of course, on April 1st is when those changed, or when they updated them. All right. So in conclusion, the NCLEX is a standard test administered by the National Council of State Boards of Nursing to determine the competency of an entry-level registered nurse and licensed practical nurse, right? I don't care, LPNs, I don't care what they tell you in school. When you take your exam, it is on a national standard, right? So can you give IV meds? No. Are you IV certified according to NCLEX? No. Can you give blood? No, you cannot do it. Now, state-wise, that's different. But with NCLEX on a national level, you don't do it at all. UAPs or anybody that's a CNA or anything like that, you can't do it either. All right. I don't care what nobody's telling you. I don't care what nursing home or long-term care facility you work at. According to the governing body, you can't do it. All right. The exam utilizes a computer adaptive test format, which tailors the difficulty level of questions to each individual candidate based on their response. So, for example, everybody, when they start their exam, you start at the passing level, okay? Your next question will determine on how you answer your previous question. So the more answers you get correct, the harder the test will be. The more questions you get incorrect, the easier the test will be. So if you start getting questions such as, hey, you're the nurse in charge of 4 patients in the emergency room. If you're a patient inside of the emergency room, if you're the nurse in charge of a patient inside of an emergency room, what patient should you see first if you have 4? That's a management of care question, right? Now, if you start getting questions such as, hey, you have a patient who's complaining of a headache, what is the normal blood pressure, right? You're supposed to know that, right? Because the NCLEX has it based off of 4 different types. You have memorization, you have remembering, you have analysis, and you have application. Your passing level questions are analysis and application, which are above the line, and then you have remembering and memorization, which are below the line. You don't want to, the memorization, I know you know what cranial nerves are. I know you know that, but I need to know if I start answering you a question, I start asking you a question in regards to a patient saying like, hey, patient, so-and-so cranial nerve 7 is an issue, blah, blah, blah. They came into here. What am I thinking about? Right? I have to go into a little bit more detail. Okay. Preparing for the NCLEX exam requires a comprehensive understanding of nursing concepts, critical thinking, and thorough review of nursing content. As I said, I am a huge content guy. Okay. Huge. And I mean it. So you have to understand what you are learning. You have to understand what you're learning in order to apply it to questions. Okay. And critical thinking, you need to be able to follow a trend. So if I present something to you here, I need to know that what is the next step? What is the next step? Okay, that didn't work. Okay, I'm going to go off to this direction. What am I going to do? Okay, that didn't work. I need to go this direction, so on and so forth. That's what the critical thinking aspect is for, okay? And that's what you have to have. And it's never going to go away, no matter what part of nursing that you work in. All right, now this is probably the most fun part for y'all, right? We're going to go through NCLEX style questions. And I usually do this on TikTok, I do it a lot. So, but specifically here, I got some really good questions for you guys. So we're going to read them. All right. And I want you guys to really think about it. All right. So question number 1, the nurse witnesses the collapse of a child while at a sporting event. The child is not breathing and has a pulse of 50. The nurse calls emergency services and initiates rescue breaths. After 2 minutes of rescue breaths, the child is still not breathing and is pale with a pulse of 30. Okay. So now I know based off of that, my patient is not getting well. They are getting worse. Okay. They are getting worse. All right. So since my patient is getting worse, which of the following actions should I take next? Right. And here's a key word. It is next. So if we go on an algorithm or a systematic approach, we've already done 1. We've already done 2. So what is the third thing? So you want to do it based off a list. Do I want to initiate chest compressions, provide rescue breaths for an additional 2 minutes? Do I want to perform abdominal thrusts, or do I want to use a finger to check the mouth for a blockage? So there should be a poll down there. I want to see what you guys are doing. Go ahead, guys. Go ahead and answer that. I'm gonna give you guys a few minutes. All right. So think about that. So now we have a child. Paint the picture. Right. They have a pulse of 50. What is a child's normal pulse supposed to be? That's a memorization question. You should already know it. Right. So, and then rescue breaths were given. After 2 minutes of rescue breaths, their heart rate or their pulse did not go up. It went down. So now it's going down and still not where it needs to be. What do I do next? Right. That is how you follow that trend. All right. Got everybody saying, okay, I see you guys doing that poll down there. I see you. Okay. All right. Okay. All right. All right. So it looks like for the majority of everybody, you guys are picking initiate chest compressions. So without further ado, let us see what that answer is. And the answer is option number 1, or A, chest compressions. Infants and children ages 1 to puberty often develop respiratory distress and bradycardia prior to cardiac arrest. After witnessing the collapse of a child who is not breathing but has a pulse, the nurse should contact emergency services and begin rescue breathing. Rescue breathing is performed at a rate to one breath every 2 to 3 seconds. If the pulse remains equal to or less than 60, then there is a sign of poor perfusion, which is why the baby is pale. The nurse should initiate chest compressions and reassess every 2 minutes. So shout out to y'all for getting that right. And here's another thing, is this portion right here, the rationale, is by far just as it's one of the most important steps or pillars when it comes to retaining the information. I don't care if you got this question right. You are to read this rationale in its entirety. And then you are to read the answers that are incorrect and understand why they are incorrect. So if you didn't pick the correct answer, you need to know why that answer is the way that it is. And then you need to know why the answer you chose that may have been incorrect, why it is incorrect. Okay. Question number 2, the nurse is triaging patients at the site of a manufacturing plant explosion. So let's think of, mass casualty type deal. Which of the following clients should the nurse ensure is transported to the hospital first? All right. So what kind of question do you think this is? Probably like a management of care, I would think, right? Like, hey, who's going to go first, right? Who is the most critical? Or if they were in the ER, hey, who do I see first? Who's going to die if I don't take care of them, right? So we have number one, a client who has a laceration to the left lower arm. Number two, a client who has an open fracture to the right tibia and an absent right pedal pulse. Is it three, a client who has partial thickness burns on both hands? Or is it number four, a client who has a large open head wound with a GCS of 3? All right, what are we thinking? What are we thinking down there? Y'all smart. Y'all smart down there, you know what I'm saying? You know what I'm saying? So think about this, right? This is where content is super important, right? So I had a massive explosion that happened at some plant. So I'm probably going to have tons of people that are going to be coming to me, right? But then I'm thinking to myself, who do I see first, right? Now, is a laceration, like, is this patient going to die? Probably not, right? So here's the thing, like, do I assess or do I implement, right? What is the very first thing that I do? Like, do I assess this patient or do I implement, right? Or a client who has an open fracture to the right tibia and absent pedal pulses. What do I do with there? Do I assess or do I implement? What do I do? Is this patient going to die? Are they going to lose a limb, limb eyesight type deal? Partial thickness burns of the hands. Are they going to die, right? A large open head wound with a GCS of 3, right? So think about that. What is a GCS, right? And if you don't know it, I would recommend that you brush up on it, right? Okay. All right. So it looks like a majority of you guys picked GCS of 3. All right. Well, let's see what it is. And our answer, we got one person that jumped in here that said the right tibia. Okay. All right. Oh, somebody else said the right tibia. Okay. Hey, and there's another thing too. Usually your first answer is your correct answer. 9 times out of 10, if you switch, you're going to get the answer wrong. Unless you can 100% tell me why you are changing your answer, you better not change it. You better listen to my voice, my soothing, amazing voice to be like, hey, you better not answer. Better not change it unless you can tell me why. All right. So the correct answer is option number 2, which is the client has an open fracture of the right tibia and absent right pedal pulses during a mass casualty event. The goal of the nurse is to triage. If you don't know what triage is, I would recommend looking that up. Triage rapidly and provide the greatest good for the greatest number of people. Clients are commonly triaged using a color code system and placed in 4 categories. When prioritizing clients for treatment, emergent needs should be managed first, followed by urgent, then non-urgent. The client with an open fracture and impaired distal perfusion, which is why they don't have a pedal pulse, is the emergent need for care because they're going to lose that leg and they'll lose it fast, right? So that is why option number 2 is the correct one. Now, the majority of you guys picked answer number 4. Now, think about it. A large open head wound with a GCS of 3 shows that they have a severe neurological issue. So this patient would be in a category of what we would call expectant, meaning they're already passed away or they're on the verge of passing away. And other signs and symptoms or signs that you could see is, if they have, if there's brain matter, on the floor, or they have a huge, large open head wound, or if they have unequal pupils, what we call blown pupils, where one is big and then one is small, right? That's another big one for you to realize, right? So remember, it's like, hey, who's going to die if I don't see them first? This patient with a GCS of 3 with an open head wound, probably already dead, okay? And also this tells you the category that it was from, which was safety and infection control. All right, and question number 3. The nurse is assessing a patient with dark skin who has disseminated intravascular coagulation. Which of the following locations would be best to assess for the presence of petechiae? Now think about it. You have a dark-skinned, complected individual, right? That could be they're from all different parts of the world, right? So where can I best see this, right? Where can I best see it? Is it the buccal mucosa or conjunctiva of the eye, palms of the hands or soles of the feet, skin over the scrotum and the heels, or is it the nail beds of the fingers and the toes? All right, we got 3 people that said whatever that is. Oh, number 1. I'm sorry. All right, I'm gonna give you guys a couple of more seconds, right? And a lot of people. So here's another way to think about it. Like, as you're answering these questions, apply them in real life. right? So if you know somebody who's dark-skinned, like myself, and you were thinking about disseminated intravascular coagulation, you're like, what? If you look at them, you're like, man, how can I tell that they're having something go on, with them like that? Right? Just like when people are learning labor and delivery or peds that have children, they use their children as guinea pigs as they're learning because they're like a little learning tool right there in front of them. Okay. All right. So we got 44% for number one, 44 for number two, and then 11%. So 1% for the nail beds. All right. Let's see what that answer is. And the answer is option one, the buccal mucosa and the conjunctivae of the eye. Petechiae or redness or purple pinpoints on the skin that occur during or due to bleeding from capillaries. Petechiae usually occur due to blood vessel injury or disorder, such as thrombocytopenia and disseminated intravascular coagulation. It can be difficult to assess skin color changes, such as with petechiae, in clients with dark pigmentation. Therefore, in clients with dark skin, petechiae can best be assessed in the conjunctivae of the eye and the buccal mucosa. Okay? So when you guys are studying for your exam, that is exactly how you should actually break these questions down. Think about it. Like, some of them you just have to know, but then it's just like, okay, now let me apply what I do know. You're not going to know everything, but apply what you do know. Like, you're like, hey, I know that's not it. I know that's not it. All right, so now you're down from having 4 answers to now having 2 answers. So now you have a 50% chance of getting it right instead of a 25% chance of getting it right or wrong. All right. And that is it on the presentation, ladies and gentlemen. So what we're going to do now, if I have a little bit of time, which I'm pretty sure I do, shout out to Marissa. I want everybody in the chat right now to tell Marissa thank you, because Marissa is my right hand right now doing all these things. So I'm going to switch my camera over so we can see what's going on here. Let me get out of there. And we're going to see what questions you guys have. All right, so it says, after graduating nursing school, are paid programs recommended to pass the NCLEX? Okay, so in my opinion, it all depends on the person, okay? So in my opinion, it all depends on the person. And here's why I say that is some people don't want to spend money. Some people don't want to, use other resources that are out there. But rather than think about it of just spending more money, think about it as investing in yourself, right? You invest in yourself with information that is out there and people that have a really good track record, whether it be a review, whether it be coaching, so on and so forth, that can get you to that next level and get you there as fast as possible. So do I recommend programs? I do. I've used them, right? I've used a bunch. I've used Kaplan. I've used Mark Klimic. I've used Picmonic. I've had Hearst Review. There's a bunch of them that are out there that you can use for yourself. So do I recommend it? Yeah, why not? But you got to also realize is that every person is different and not every review will fit you. But you go into purchasing those knowing that risk. So you have, and that's how investing is. Like you'll invest in a stock and not know everything about it, but you surely put your money there, right? So think about it that way. Okay. All right. Question number 2. How do I keep up with curriculum and concentrate on the NCLEX? So when it comes to keeping up with curriculum in regards to the NCLEX, you need to put yourself on a time schedule as well as create a study plan for yourself. So my first recommendation would be, as you're creating a study schedule, like print out a calendar, do it on Google Calendar or whatever you want to do, and stick with the very first sections that you have a problem with. Pharmacology was a monster for me. So I started out with pharmacology lectures when I was studying. And when I studied those for however many days, implemented my questions, implemented my breaks, so on and so forth, into that day, as well as I monitored and I documented what I did by the hour. And then every other day or so, I would audit my time so I could focus on what I needed to focus on, or get rid of all the fluff of the day, as we should say, right? So that would be my recommendation on concentrating in NCLEX. Also, get rid of people that don't need to be there. If they're not supportive of you, get rid of them. Like, You don't need the negativity and you don't need the distraction. So cut everybody off and focus. All right. Our next question, how to study in nursing school. Please be specific. What specifically should students focus on when studying so you will not study more than you need to? So I'm just going to be completely honest with you. Whoever asked this question, nursing school is hard. Nursing school is not a joke. It's not a game, and it's nothing to be played with. The very first thing is your instructors are going to tell you, hey, read the whole book. You put a book in front of me, I'm going to fall asleep. So I'm just going to be completely honest. So it's like you're asking like, hey, where do I focus? So your focus should be on where you are. So everybody's going to start in fundamentals and like health assessments and, so on and so forth. So my recommendation, and this is huge, and I didn't find this out until my second semester in nursing school, is to get into a group. Get into a group. And by that, I mean you and 3 other people, right? And then when you guys will say in fundamentals and you guys are talking about the nursing process and you guys are learning about basic care and basic safety and stuff like that, and you guys know that you're going to have a test. When you guys have a test, collectively for, we'll say chapters 1 through 10, split them up in 25%. You do 3, you do 3, you do 3, or you do 2, whatever. I'm doing, boy math right now, apparently. So split those up. And then once you split them up, put them all together. And so you did 25% of the work, but you reap 100% of the benefits. All 4 people do. So that would be one of my recommendations. And you said focus on studying. That's how you focus. Get rid of all the nonsense. Don't think about what's happening. Don't think about Taylor Swift and Travis Kelce, because that's not important. Travis Kelce is an NFL player, and Taylor Swift sings songs. You trying to be a nurse? Y'all are not the same. Okay, so that would be my recommendation on how to study effectively. Okay, effectively. All right, next question. What's the average passing rate for the new NCLEX? So based off of the National Council of State Boards of Nursing, and like I said, they are the governing body for the NCLEX, currently it is at 87%, which is a lot higher than it was before with the last generation NCLEX, which was at like 80%. So they're actually seeing a lot higher numbers and a lot better feedback with the new generation NCLEX format type of questions. A lot of people love the case studies. I personally love the case studies. I think that they're great because they give you everything that you need. It's essentially, the case studies is as if you were on a shift taking care of a patient. Like I said, they give you the medical history, the vital signs, the nursing notes, the labs, and the further the questions that go on, they'll update them, so on and so forth. So that's what the passing rate is. And if anybody ever wants to know what the passing rate is, definitely go check out the NCSBN.org website. They have it plastered all over the place. You can't miss it. All right. Next question. What's the compact license called? Oh, sorry. Oops, guess not. Marissa, what are you doing? Oh my God.
Sorry, we'll go back to what's compact license called. Let me bring that up.
No, we're good. We're good. Hey, everybody tell Marissa that she's awesome. All right. Don't play with me. All right, here we go. So what is that? What's that compact license called? So the compact license is called a nursing or the nurse's licensure compact. That's all it's called. So essentially all it is just an agreement, or a reciprocity act that was created for nurses to get their licenses in one state but can practice in another. So like I said, I live in Texas. I could go to Georgia with my Texas license and I could work there. So if I wanted to take a travel contract or if I want to do anything, I could go over there and I could work temporarily and I don't have to apply for their nursing license for their state. Now, if I want to move there or live there, I would have to, then you're required to get their license through their state. Okay. All right. Next question. All right. It says, will there be recording available? I'm an HST and 6 hours behind. Okay. I joined late and missed the entire session. Yes, it will be recorded. It'll be recorded and it'll be sent via email. And this whole conversation that we're talking about, you will be able to see. So thank you for your question, Ruthie. Sorry, but what can't they do? LPNs. So remember, like I was saying, LPNs, it's on a national standard, not a state level. And this is for Cecilia. For example, state, it all just depends from state to state on what an LPN can do, what certification they can get, so on and so forth. So, but according to the NCLEX, the NCSBN says that you can't do IV medications, right? You can't do it. You can do IM, you can do IO, but you can't do IV. You can't do blood transfusions. You can't do nothing like that. Certain states will allow for you to do that. And here's the biggest thing about from RNs to LPNs when it comes to the NCLEX. LPNs, you need to know what you can and cannot do. You need to know what your roles and responsibilities are. You need to know who you can accept and who you can't accept, right? Can you do sterile procedures? Yes, such as, or can you do wound changes? Yes. Can you do Foley's? Yes. Can you do central line dressing changes? No, right? That's an RN's job. Can you do anything with a central venous access device? No, as an LPN, you cannot, okay? So hopefully that answers your question. Next question. For the pharmacology section on the NCLEX, how would you recommend studying? Oh, Marissa, this is such a great question. So my recommendation is you need to understand the family name and the suffixes in regards to the pharmacology section. So I'll break this down. This is the example that I use every single time. Now, we're going to talk about cardiac meds. Cardiac meds consist of, ARBs, ACE inhibitors, sartans. What else is in there? Your beta blockers, your calcium channel blockers, your diuretics, your digoxin, stuff like that, right? So, all right, cool. So I know those fall under my cardiac meds, but then I have to give my patient, labetalol. Okay, so I know it ends in LOL. Every LOL is a beta blocker. Every beta blocker is an LOL, right? So I know it falls under that category. The family, which is cardiac meds, and I know the suffix is the LOL, and I know it's a beta blocker, right? So now I need to know what are the signs and symptoms of somebody, or what are the signs and symptoms, or what does that medication do? Lowers my blood pressure, lowers my heart rate, but what are the signs and symptoms of me giving it to somebody? What is the expected outcome? And then what is the unexpected outcome, right? And so now I'm thinking about safety. Remember, nursing, it's all about safety, right? All about safety. So I'm thinking about orthostatic hypotension. I'm thinking about low heart rate. Hey, do I take vital signs before I give medications, right? What if their blood pressure is like 110 over, 74, and then you decide to give them, a beta blocker, and then next thing you know, here they come back and now they're like, obtundant, or they have a low, a decreased level of consciousness because you didn't hold the medication. Hey, and don't be tricked by the exam either. Like they will ask you expected outcomes. Like, yeah, that's okay. You can do that. Okay. Hopefully that answers your question. Next question. All right. How many chances do you have to take the NCLEX exam in case you don't pass for the first time? Well, that all just depends on the state. So I know in Florida, you only get 3 chances to take the exam before you have to, appeal to the Board of Nursing. In New York, I know it's like unlimited. In Texas, you have a 4-year time period to take it, but you could take it as much as you want within that 4-year period. So it all depends on state to state. Okay. Good question, Cecilia. And on our last question here, what programs or even study material would you recommend? For example, the Saunders book. So I can recommend a ton. I have a program myself. It's called the 7-Day NCLEX course, which is being updated every 2 weeks with content to include an NCLEX review, and soon to be one specifically for PNs as well. And there's other ones such as like Mark Klimick. You have the Kaplan review. You have Hearst. You have REMAR. You have, if you're an LPN, there's another one that's called Nurse Sam. She has a study bundle NCLEX. What's some other ones out there? NCLEX High Yield is out there. I'm not a big, I can't look at a book. Like I have a Lippincott book down here. I have a Saunders book down here. Let me tell you, me and books don't be booking like that, So, but those will be some of my recommendations when it comes to that. Looks like we got another question. How would I go about getting a license in Texas if I'm graduating in California, but not going to work in California, moving to Texas right after school? So since you got so here's the thing. Since you went to school in California and graduating in California, you have to get a California license. However, you can take your California licensing, or you can take the NCLEX exam anywhere in the United States, as long as you go to an approved testing center. Now, once you get your California license, because California is not part of the Nursing Licensure Compact Act, they're not a part of that. So what you would have to do is, once you got your license through California, you would then have to submit to get a license through the state of Texas, which is not hard. You just go to the Texas Board of Nursing, and then they will be like, hey, are you transferring, so on and so forth, and you just follow their steps. Okay. So Maria, that was a good question. And I think that's all our questions right there. So, yeah, I think we're pretty good at that. but the NCLEX and yeah, follow me on all those social media platforms. The link tree or whatever else is available. Follow me on Instagram. Follow me on TikTok because I'm kind of controversial out there because they be acting up. So, but I wish everybody well on their journey through nursing, all of nursing, not just school, pre-nursing, school. Once you get out here and get your license, the journey is definitely going to be a wild one, but I have no doubt in my mind that you guys are going to be successful. So I hope to see you guys out there.
Awesome. Thank you so much, Kevin. We're wrapping this one up. So we'll see you guys at the next session starting at 2 p.m. with Sandra Wong discussing effective study techniques to master the NCLEX. And like Kevin said, don't forget to follow the link that will bring you to his link tree for all the places you can find him.
Awesome. Thanks, Marissa. Appreciate it, guys.
Thank
Have a
you,
good Sunday.